It's mandatory that everyone should go through a set of blood tests because we all are into anti-aging and skin glow and everything.
Yeah.
So stress is one of the most commonly faced issue.
Welcome to PicPax podcast. Today we have a special guest, Dr. Rageena. She's specialized in IV nutrition therapy and diabetes management. She's graduated from UK, University of Warwick. And the service she is providing is very unique, and I'm sure our audience would be interested in. Let's hear from her. Hi, doctor.
Thank you so much, Donna, for inviting me for this podcast. I work for Call Doctor, and it's one of the first team in the market to start such kind of unique services. Basically, we go to the patient wherever they are, home, hotel, or even offices. We ask and treat their symptoms, do all the investigation then and there, give injections or IVs, whatever is required. So basically, we have a very strong relationship with the patient, knowing the progression and regression of the symptoms. And we even have a follow-up with them until they are going through the entire journey of disease or wellness.
So that's interesting, doctor. What kind of services do you offer?
So basically, we have a lot of pediatric cases. We manage chronic pain. We manage emergency cases to a certain limit, like minor wound, maybe. We also have a lot of geriatric cases, long-term patients. And we even do personalized IV therapies at home.
What is exactly IV nutrition therapy?
IV nutrition therapy is delivering vitamins and minerals directly into the bloodstream. So the effect is faster.
Okay.
If the person is looking for an overall wellness, performance, if he is athlete or anything, or if the patient is deficient, this works amazing.
Great.
Second thing is that we also give this vitamins also for people who are suffering from a chronic illness. Maybe he's going through a chronic pain, maybe he's diabetic, maybe the patient is athlete and he needs more energy. Sometimes even for hair loss, even if the patient is currently ongoing any kind of flu and symptoms or any kind of gastrointestinal problems, the vitamins and minerals going directly into the bloodstreams gives him a quick relief of symptoms.
That's great. Okay, doctor, that leads me also to other questions. What's the most interesting things we can do with IV nutrition therapy?
See, we get a lot of patients complaining of exhaustion, fatigue. They don't feel their day.
Okay.
Then immunity building, hangover treatment.
Okay.
We have a lot of aesthetic purposes like the skin is not good or they want anti-aging, antioxidants. And we focus on personalized IV vitamins. Like I don't do a regular vitamins for everyone. So we focus what is the requirement for the patient and then do the IV.
Great. That's great. So the concentration would be different, right?
Yes,
Also,
definitely it is different, yeah.
That's great. Thank you for the insight. Is there any potential risk that can happen from the IV therapy?
Yes, there is. So basically, I have seen a lot of apps where you just click on I need hydration or you click on antioxidant and then you get it. What we do differently is that we see the patient, we go personally to the patient, we assess the patient really well. What are the vitals? If the patient has any diabetes, we assess the patient completely, look what is the medication they are taking, and then we personalize accordingly.
Okay.
We don't, even if the patient wants hydration, we just don't do hydration just like that. We assess the patient and then give it. Maybe the patient is a cardiac patient and we cannot hydrate the patient with a lot of fluids, or he's a chronic kidney patient. So there is a lot of things which you have to be conscious about before doing an IV therapy.
You're totally right. Yes.
Yes. And another thing what we really focus on is that if the patient is already on supplements, and we don't want to give more additional dosage. So that's why it is also important to assess the patient, look what the medication they are taking, and then personalize accordingly.
That's great. To avoid toxicity, right?
Yes.
That's great, doctor. Thank you. So, Dr. Rageena, speaking of vitamins and supplements, what are the essential vitamins and supplements that everyone should consider for their overall health?
See, vitamins and minerals, it depends with various conditions. Like, for example, your lifestyle, gender, male and female, depends on your diet, some chronic conditions, and many other factors, honestly. So there's no set of vitamins which I would say that you take and I take.
Yeah.
There's nothing like that.
Yeah.
For example, for elderly, if they have any chronic conditions, we customize or we give a set of vitamins, also listening what exactly or what symptoms they have. So it's mandatory that everyone should go through a set of blood tests to understand if they are deficient, or listen to them what exactly is their diet and lifestyle, and then personalize accordingly. So what I understand is that when you meet a patient, like what we do, like when we see a patient, we take a proper history, take the full diet history, their lifestyle, their stress, because stress is one factor that everyone go through.
Sure.
And it actually hinders with the nutrient absorption in your stomach. So then we do a blood test and then give the supplements to the patient.
Actually, that was also one of the points interest us in PicPax. That's why we have the service. We offer now the service, even it's home service for blood test. We send the DHA licensed nurse to the at the comfort of the patient home. They will collect the blood sample, and then as per the report, then we can recommend the vitamins and supplements.
That's something amazing, because you don't need to take anything excess. You take what is actually required, because when you take anything excess, your body goes through the stress of excreting it. You're giving overburden for your liver and kidney. So it's always better to go through a blood test and then decide.
Also, we have other service. Even after that, we can offer like chat with the nutritionist and consultation.
That's perfect.
Service, so they can understand exactly what they need. She can design for them like the diet plan and everything, so it suits their healthy lifestyle in a perfect way.
And that's the best way to do it.
Yeah.
Perfect.
Yeah. So as you know, we have seen cases of some patients that they would just go to the pharmacy, they would just pick whatever vitamins are advised, or they will just go to the internet and search about the benefits of some of vitamins, and they will start to take it. Maybe also they will just word of mouth some of the trendy vitamins on social media, and then they will start to try it. So what's your advice? What's the professional way to know what really my body needs?
Yes, Donna, you're right. Actually, vitamins, you and I know, vitamins depends on individual to individual.
Yes.
Depends on your lifestyle, on your gender. Like female and male have different requirements.
Yeah.
Also, if you're having any kind of chronic diseases, many factors. If you're going through stress, there's a lot of other factors. If you have a gastrointestinal problem, then you need an additional requirement because the absorption goes really low.
Yeah.
So rather than going to a pharmacy or over-the-counter medication or just picking yourself, you actually should go through a set of blood tests if that's possible. Try to understand if the patient has any deficiency. Also check what is the diet that the person is going through. If he's going through a nutritious diet and he's having a very healthy lifestyle, he doesn't have any symptoms, he doesn't have any chronic disease, he's perfectly all right, I would suggest the patient don't require to take a multivitamin. Because if everything is okay, then it's fine.
Yeah.
Okay. The second thing is that if the patient is undergoing a lot of stress, his lifestyle is bad, is not taking a proper diet, then yes, definitely he need to take supplements. So it depends from person to person, as I explained. So we cannot really say that you have to take a set of vitamins and somebody else have to take the same supplements what you're taking. Depends on individual to individual and basically based on their conditions.
Yeah.
So what I would suggest is that if the patient has any symptoms or yearly basis, it's always better to go through a set of blood tests. And people should really understand that's mandatory.
That's interesting,
Yeah.
doctor. Actually, at PicPax, we offer this service, blood checking analysis.
That's good.
For it's more than even 50 biomarkers.
Oh.
So everybody knows exactly what are the deficiencies and what they really need to take. So it's even at home service. So
Amazing.
Yeah, they
that's
don't
something
need to waste
really,
time.
yeah, that's something really good you can do, because person is not going through an illness, right?
Yes, right.
So most of them neglect this part of wellness.
Yeah.
But actually taking such kind of supplements will make your lifestyle much better.
Yeah.
Your energy, your overall wellness, your performance, your focus, everything can be improved.
Yeah.
So Donna, what happens after the blood test?
So, okay, after the blood test results comes out from the lab, we will share it with the patient, but it's not only the lab. We will share also like our recommendation to it, and we will add also lifestyle and diet plan if they want.
Okay.
On top of that, we're also offering detailed consultation to the patient if
With
they
the
need.
nutritionist.
With the nutrition.
Oh, amazing. That's
Exactly.
really good. Yeah.
Yeah.
That's the best way to do it, actually.
Yeah. So we can customize it to according to their lifestyle.
That's perfect.
Yeah.
So that's what I ask my patients also. Like, I don't want my patients to take anything which is not reliable.
Yeah.
Either I prescribe it for them or I ask them to go for a reliable brand.
Yeah.
Because I don't want my patients to take anything which is toxic, if there is any toxic elements in it, or even if they are not really aware of the concentration which is not mentioned, anything too much or anything less.
You're right.
You understand?
Yeah.
There's almost 90,000 supplements in the market, different kinds, and they get really confused what to take and which brand to go. So I think PicPax really does a good work in it. Amazing.
You're right.
Yeah.
But rest assured, like all our products, quality tests are done for them. It's tested by the DHA, Dubai Health Authority.
Okay.
All tests done also by the Dubai Central Lab. It's non-GMO, no bulkers, no fillers, no synthetic preservative. So it's totally natural, pure, and 100% you can prescribe it to your patients. Yeah,
that's really good. Yeah. I would also like to add on, like, I have a lot of patients who are athletes or fitness freaks or cyclists. They go with the standard plan of taking protein, amino acids, lot of multivitamins, so on. But then still they complain the performance is not that high, or they're not achieving it, or they cannot complete it. So there it helps with the set of blood test and then personalize according to their needs.
Okay.
Also listening to their understanding what is their chronic conditions or whatever their complaints are. So you cannot go with the standard plan as explained earlier. So that's where I feel, we have to personalize the vitamins rather than going for the standard plan.
Okay, doctor. So also biotin is one of the most selling products from our range by customers who are suffering from hair loss and hair thinning. So what do you think, what is the most effective vitamins and supplements for these cases, hair loss, hair thinning, brittle nails? What is good for those cases?
See, before going to vitamins and minerals, the first thing is your lifestyle modification. 90% is your lifestyle, your diet, your stress. Then the 10% comes with the supplements. It depends on your genetics, it depends on your hormones, it depends on your life, your diet, your exercise. So there's multiple things which is involved in it. So the moment you have a hair loss, it's not that you just take a supplements and then you're fine. It's nothing like that. So as I mentioned, it's 90% your lifestyle. That's where the vitamins helps. So if you're not taking a right diet, then the vitamins and minerals supports will cover. Okay, it just gives it just helps for the strengthening and prevent hair loss. So for my patients, definitely if my patient is going through any kind of hair treatments, or even for the hair loss, even if the patient is going through a PRP or any kind of procedures, I still add on a set of vitamins just to support the hair growth and hair loss.
That's
okay. So that's one thing we can do for the hair loss. exercise is the key, and stress reduction.
Yeah.
So again, there are vitamins which help relax yourself and reduce the stress.
Yeah.
So definitely vitamins and minerals helps a lot.
Yeah. Just I will come to the point for the vitamins and supplements for hair loss. So do you specifically recommend something special for these cases?
Yes.
Yeah.
See, the first thing everyone will go for is biotin. The moment you say that, even our friends or anyone, the moment you start saying you have a hair loss, then you have to start taking biotin.
Yeah.
But that's not the only one. You have to really make sure you have enough zinc, enough magnesium, B vitamins, especially the B12, and collagen, and then iron, because females, especially if they have a hair loss, then there is definitely an iron deficiency.
Yeah.
So there is a set of vitamins which you really need to focus. Yeah.
That's great, doctor, because also we have an amazing product, which we name it as a Glow-Pax.
Okay.
So from the name Glow-Pax, so it will work on everything, hair, nail, and skin. So it contains actually mostly of the vitamins that you mentioned, collagen, biotin, zinc. So I think it will support a lot, and I would love to everybody will try it. It will be very effective.
Yeah,
I'm sure. Okay. Also on a similar note, like what's the best supplements for skin health and anti-aging?
This is one of the, most of my patients are asking the same question. And because we all are into anti-aging and, skin glow and everything. So I think we all need to focus on our lifestyle, which I have mentioned earlier as well. Because you take a lot of supplements, you take a lot of injectables, it doesn't last if your lifestyle is not healthy. So diet, proper hydration, proper exercise is the first thing to be done. To add on, you can add collagen to your supplements. You can add zinc, because that plays a very good role in it. You can add resveratrol. You can add hyaluronic acid if you like, and glutathione also plays a very important role in it. And for a short period of time, you can even take vitamin C. It helps. But I wouldn't recommend to take continuously, but you can take for a short duration of time.
I think I hear, doctor, like the vitamin C should be taken with collagen, right?
Yes.
So to help the absorption.
Yes. And the effect is much better.
Yeah.
And I'll also ask my patient to take a good form of collagen. And that's also very important. And does PicPax has collagen?
Yeah, we have actually this one of our best selling, because the rest of collagen products in the market, usually you have to take 6 tablets to have the dose of 10,000 milligrams.
Yeah.
This is really a pain to have like 3 in the morning, 3 in the evening.
Yeah.
It's hard, especially if the patient already is taking another supplement or medication.
Yeah.
So what's good at PicPax that the collagen that we have, it's only 1 tablet, and it has the 10,000 milligram concentration, and you just take it 1 time per day. And also, as advised, for sure, the collagen should be on empty stomach, so the absorption will be the best, and to be combined by vitamin C for better absorption.
Yes, true, you're right.
Yeah.
And when you just mentioned about this, the amount of tablets what they're taking.
Yes.
See, we get a lot of complaints, or you just mentioned, doctor, I have a lot of tablets to take per day.
Yeah.
But I always explain my patients, like, you cannot just take on just one multivitamin if your requirements are different. Because when you go for a multivitamin, the dosage is different. Like maybe you need more magnesium, maybe you need more zinc, and maybe you don't require that much of iron. So for some people there are a lot of iron, so you don't need to give an extra iron.
You're right.
So that's why customization is very important. It's a hassle of taking a bunch of tablets, but at least you take what is required for you. And maybe you just want to take vitamin C for a short duration of time, or vitamin zinc just for a short duration of time, and then stop, because you don't need to take zinc in a higher dose, or for a longer time, maybe you don't want to take it. So that's the best way to do it. Amazing.
Yeah, also, doctor, just we received many questions from our patients. So they are asking, what is the best time to take the vitamins? Like for how long they should use these vitamins to see a result in their skin, for example?
See, some vitamins need to take in the morning and some to be taken in the evening. That depends on what specific vitamin they are going for.
Okay.
And if you ask me the question how long they have to take it, it depends from body to body.
Okay.
Maybe I need to take it for 6 months because my gut absorption is different and your gut absorption is different.
Yeah.
Maybe I have a deficiency and you don't have a deficiency. So that depends from individual to individual.
Yeah.
There comes the consultant, because there the consultant can help you. The nutritionist or a GP doctor or a doctor can help you out deciding the duration of medication. You cannot just take one set of vitamin for like 6 months, 1 year. Sometimes you don't need the set of vitamins for the next 3 months.
Yeah.
So ideally, to see a result, you have to take at least for 3 months and check. Maybe you need to increase the dose. Maybe you can even decrease the dose.
Yeah.
So you have to have a personalized plan, basically.
Yeah. Related to sleep and stress management, what do you think is a good supplements to help us to relieve the stressful daily routine that we have? So how to manage that?
Stress is one of the most commonly faced issue. And then you start with stress, then you reach to a point that your anxiety level are really high. Then you have a problem with sleep. So the first thing I would ask my patients to do is start exercising. So exercise really calms down because the blood circulation is better. Everything comes into place. So exercise is the first thing to start with, and then add on supplements to just help you a bit. So magnesium helps you a lot. B vitamins helps you a lot. To go with natural substances like rhodiola, moringa. And these products even helps you for a better sleep as well. So that's how we suggest our patients. And definitely the patients has shown a very good results if you merge all this together.
So it's improving the sleep quality as well, not only stress management.
Yes. As I mentioned, then you need to really work on your exercise as well, and then you really need to understand the root cause of stress. So and you need to work on it, how to make yourself better. Some people really wanted to go for shopping or travel or do what you like.
You're right.
Help yourself and take the supplements. It works amazing.
How do you handle people with low energy problems?
Of our patients, the first main thing they say is that, Doctor, my energy is very low. My fatigueness is high. I am really weak. So then we really need to evaluate why is it. So first thing I ask, what's your diet like? Maybe they are even having a very healthy lifestyle, but we just ask, what is a diet like? Sugar is one thing which will really bring your energy levels down. It impacts your sleep, everything. It's related to the entire body mechanism. Okay, so diet is one thing that really improve your energy levels.
Okay.
We know exercise helps a lot. When a patient really tells me that the energy level is low, we make sure the blood test is done. That if they have any main deficiencies, like if their iron levels are low, if their B vitamins are low, magnesium is low, definitely we need to work on it. We need to give a proper supplements, especially D vitamins. The main thing what vitamin D deficiency patients say is that they are extremely fatigued. They have pains and aches. They have a lot of hair loss. So that's the main complaints by the patients. And then once you do the blood test, then we work on it. We give a proper vitamins. Again, if everything is done, we also depend sometime on the natural substances. And if our ancestors really depends on natural substances, why can't we? And I really believe it helps a lot. I was wondering if PicPax has any kind of natural substances for all of this?
Yes, sure. We have also some good range that can boost energy. First, I would like to start with astaxanthin. Also, we have selenium, spirulina, and the most also selling product that we have, it's a boost bags.
Okay.
It has 5 different antioxidants that work really well to boost energy.
Okay.
This is the best selling also.
Amazing, amazing. And I really believe it will work amazingly. Yeah.
What is the supplements that are important and helps regulate the hormones for women, especially if they are suffering from PCOS, PMS symptoms, menopause? So they usually suffer from mood swings, hot flashes. So what is the professional way to deal with this cases?
Okay. Get a lot of patients having these similar complaints, even the teenagers, even females in 30s, where they have already been diagnosed with PCOS.
Yeah.
And definitely they need to get a proper treatment from a gynecologist.
Yeah.
Okay, maybe they might be prescribing some kind of medications like metformin or glucophage. And to add on, we can give myoinositol, which helps to regulate the cycle. And definitely, lifestyle is the key.
Sure.
You need to bring down your weight, maybe. Even exercise helps a lot.
Sure.
And for
menopause,
yeah, then the hot flushes and the mood swings really affect them very badly. And even then, they have a very low energy. So evening primrose oil helps a lot.
Great.
And black horse really helps a lot. So it depends what the patient likes to take, but they really helps a lot to stabilize the mood, and even they feel the hot flushes are going down gradually.
So doctor, we will move to some questions that we have received through our WhatsApp chat from the customers. So okay, first we'll start. What's one vitamin everyone should start taking today for better health?
I would recommend vitamin D. As most of the patients are deficient, we definitely need to do a blood test to confirm if you are deficient. Even if you're not deficient, a very low dose like 1000 to 2000 milligram is perfect.
Yeah.
It improves your health, and if you're deficient, definitely you have to go for a higher dose. Yeah.
Okay. So I will move to next. Can taking the right supplement really improve your hair and skin?
Yes, definitely. When you do all the things like lifestyle, diet, together you take a supplement like biotin, collagen, zinc, magnesium, iron, it definitely will improve your skin and hair. Yeah.
Great. Okay, so next, what's your go-to supplement for a quick energy boost?
I would recommend spirulina, selenium, magnesium, and B vitamins.
Okay, great. So next is, which vitamin is your secret weapon for stress relief?
Rhodiola, B vitamins, and moringa.
Yeah.
You can add on magnesium as well.
Is there a supplement that can help improve your memory and focus?
Yes, there is. I would suggest omega-3,
Yeah.
ginkgo biloba,
Yeah.
B vitamins, D will help a lot.
Great.
Yeah.
What's the best supplement for sleep, especially for people who struggle to fall asleep?
I would really recommend magnesium. It calms you down a lot. And you can go for rhodiola and moringa.
Okay.
Yeah.
Next is, how can women use supplements to manage menopause symptoms?
Okay, so I really recommend taking evening primrose oil, and black horse helps a lot.
Great.
Yeah.
Are there vitamins or supplements that can naturally enhance libido?
Yes, maca works really well, and L-arginine, which is a amino acid.
Yeah.
It stabilizes your energy.
Great. Yeah. Thank you, Dr. Rageena, for your time today, and it's been a pleasure to have you on the show.
Thank you.
Also, if you have any more comments, you can or questions, you can comment below, and we will invite Dr. Rageena for another podcast to answer your questions. Thank you.